Hello, I'm Dr. Bruce Eimer. I'm a licensed psychologist here in South Florida. I'm a board-certified hypnotherapist, and I'm also a board-certified psychologist in cognitive behavioral psychology with the American Board of Professional Psychology. Today, I'd like to talk about some helpful tips for handling what we're all going through right now in coping with the coronavirus pandemic and the fear of getting infected or infecting others. I'd like to do this by giving you information about a 2-day course that I'll be teaching this month as a webinar on using hypnosis for preventing or treating and taming depression. I presented this course last year at the annual meeting in Daytona Beach of the International Medical and Dental Hypnotherapy Association, and I was to present this course again this year in Orlando at the annual meeting, but the annual meeting had to be canceled due to the coronavirus epidemic, and instead the International Medical and Dental Hypnotherapy Association is putting on a virtual conference, and I am going to give this 2-day workshop as a webinar later on this month. You can go to the website of the association to find out more and, of course, to register. And that address is www.imdha.com. That's www.imdha.com to register for my 2-day webinar on using hypnosis for taming depression. Now, what I'd like to do is I'd like to talk about how hypnosis can be used to tame depression. We're all experiencing anxiety about the current epidemic of coronavirus. When anxiety isn't managed and it continues to fester and to get worse and worse, it can turn into depression. Because what happens is it leads a person who is anxious and worried and feeling not in control. It can make that person begin to feel helpless. Anxiety builds on itself. Worries turn to more worries. And eventually, the individual who has persistent anxiety that is unabated and uncontrolled begins to feel helpless, and that helplessness turns to hopelessness. When a person feels helpless, and worse yet, hopeless, that person begins to become vulnerable to developing depression, which is a sense that the world is adverse, everything is turning dark, that the future doesn't exist, that one is a failure, that one's past has been all for naught, that one can't function well, and that one's life has become a failure. And depression is a terrible, terrible thing. It has a major cognitive component, which is a negative view of self, others, the world, one's past and one's future. Everything is viewed through a dark lens. It has a very significant emotional component, which is this overall feeling of dread, sadness, guilt, self-blame, this feeling that one is unable to do anything, a sense of helplessness, of course, widespread, continual dysphoria, It has we said cognitive, emotional, it has a physical component. There are a host of physical symptoms of depression, which include fatigue, listlessness, inability to be motivated, lack of motivation, lack of the ability to experience pleasure, inability to do anything, inertia, to get started or continue of anything, inability to experience pleasure, which would also correlate with a lack of libido, loss of appetite, inability to sleep or sleeping too much, a feeling of just not being able to do anything, slowing down. My late wife, actually died from depression. She died from suicide. Depression is deadly, and depression can cause suicidal ideation, and unfortunately, it can also result in suicidal behavior. In the final year of my wife's depression, she was almost catatonic. She had episodes where she couldn't think, she couldn't talk, and she basically was blank inside. She couldn't communicate or relate. Depression destroys cognitive ability. It can masquerade as dementia. People who are depressed can't focus, can't pay attention, and experience everything as being just very, very painful. Depression is very painful. It causes despair. People who are very depressed don't feel settled. They can't find a place for themselves. It's very, very, very painful. For a long time, people thought that hypnosis was not a good treatment for depression because there was this misconception that hypnosis is sleep, and that hypnosis puts people into a relaxed state, that hypnosis takes away initiative, and of course that all those things are myths. Hypnosis is a way of basically helping someone to become aware of their inner strength. Hypnosis is a way of reprogramming the negative self-hypnosis of depression, the negative trance, through the use of trance suggestions to tap into the positive, hopeful, resourceful parts of the individual. Hypnosis, being that all hypnosis is self-hypnosis, is a way of basically helping someone to begin to experience life as worth living in measured doses of hypnosis. We never want to bite off more than we could chew, and therefore we want to go slowly and in a measured pace, addressing the person as they are sitting in front of you. What I'm going to do in the workshop, the 2-day webinar, is it's going to be an experiential workshop. It's also going to be didactic. Whoever attends will have the opportunity to interact with other attendees as well as with myself, and we'll be going through concepts and ideas that have very useful information that are directly applicable to using hypnosis to help tame depression, and then all the attendees will be experiencing these ideas through various exercises that I'll be taking you through. The model that I have come to over the years as a clinical psychologist treating people with anxiety, depression, and chronic pain is a model which I call the Taming depression model, which basically is the idea that we have to look at what's going on, and we have to listen to the symptoms and the experience of a person's depression to understand it as the unconscious mind and the body talking, communicating with the depressed individual, so that the depressed individual can listen to what the unconscious is asking for, listen to what the body needs. And it's a focusing of looking at what that person really is missing in their life, and what that person has inside that they can use to find, to connect with what's missing and bring it inside so that the person can begin to heal. The whole idea of taming that I came upon years ago was applied, I applied it to treating chronic pain. The idea of getting to know the pain, and depression is a form of pain and is very, very comorbid with people that live in chronic pain, and a high risk factor for people in chronic pain, that is, to become depressed. And the idea of taming pain is to listen to the pain and find out what it's telling you, to pay attention to it and not try to kill it. I've developed a model called the AWARE model, which essentially looks at any kind of problem from the standpoint of, well, we have to start somewhere. We have to start with acceptance of reality, even though it might be distasteful. Then we have to make a commitment to find a better way to deal with that reality. The word AWARE is actually an acronym where A stands for acceptance, okay, and W, the next letter in AWARE, stands for watch. And basically, this is watching and observing what's really going on, listening to oneself, listening to one's symptoms, listening to the depression, looking at how one deals with the world, how one is responding, how one is dealing with one's pain, how one is dealing with other people, and how other people respond to that. The third letter in AWARE, which is also an A in the model, the AWARE model, stands for adjust. And basically, we're looking at adjusting one's responses based on the interesting information that one learns from watching and observing all of the above. Adjusting one's responses means making tweaks or adjustments in one's behavior, one's interactions with other people, looking at, listening to, paying attention to the physical sensations in one's body, and thinking about ways to adjust one's experience of those sensations. Those sensations are signals that something needs to be done. Depression is a signal that something needs to be done. Paying attention to one's emotional symptoms. Emotions are signals from your body and from your unconscious mind that something needs to be done. Paying attention to those signals and then making some slight adjustments. And of course, looking at those adjustments kind of as an experiment, like what will happen if I do this? What will happen if I do that? Okay? In the acronym AWARE, we have accept, watch, adjust, and then R, which is the next to last letter in the word AWARE, in my model stands for releasing. We're talking about releasing unnecessary emotional burdens from the past, okay? Releasing unhelpful beliefs, releasing resentments, forgiving others and oneself, letting go of feelings that one had been attached to that are weighing you down. And the final letter in the AWARE word and the AWARE model is E, and that stands for envisioning a better future. Behavioral rehearsal is one aspect of that, imaginal rehearsal rather. But the idea of envisioning a future, because people who are depressed either see their future as very dark or don't see a future at all. Now, fortunately, animals, such as my German Shepherd dog Leo, don't get depressed in the same way that people do because they're very concrete. However, dogs who are very, very sensitive to the moods of their owners do exhibit symptoms of depression when they're treated poorly or abused. It's a lot easier to treat a dog for depression than it is to treat a person, because people are a whole lot more complex cognitively than dogs are. I thought what I would do to give you a little bit of a taste for some of the things that you'll learn and some of the experiential exercises that you'll have when you take my live webinar this month. And pet therapy is definitely a very effective form of therapy for helping people who are depressed. It certainly helps me. I'd like to share with you a brief exercise as a taste for what you'll be getting when you take my webinar. Okay, so in this exercise, all I'd like to ask of you is for you to find a comfortable place, make sure that you are not driving or operating any kind of machinery that requires your attention, and let's just take a couple minutes to just simply focus inside. And the best way to do this without any real demands on yourself is to just gently close your eyes and to just simply pay attention to your breathing, and begin by taking a few slow, deep breaths. Breathing in slowly through your nose, deeply, until you completely fill your chest and your lungs with air. Hold that breath for a moment, and then let that breath all the way out as you breathe out through your nose or your mouth. Breathing out more forcefully, of course, is easier through your mouth. Just blowing that air out until you completely blow away the tension and the stress, and then begin to fill your lungs again. Breathing in, breathing in, breathing in, filling up, filling up, filling up, filling up until your lungs are completely full, feeling that pressure in your chest as you hold your breath for a few seconds. And then again, letting that breath all the way out, blowing stress and tension out into the atmosphere. Let's take one more deep breath, breathing in, filling up, filling up, filling up, and then holding your breath for a few seconds, and then breathing out all the way down, blowing all the stress and tension out into the atmosphere. Now just breathe normally. Breathe normally and just pay attention to your breathing. And just notice your breathing without trying to change your breathing. And as you pay attention to your breathing, be aware of whenever your mind wanders. Whenever your mind wanders, that's perfectly normal. And every time you notice your mind is wandering from your breathing, that's a cue to bring your attention back to your breathing. Each time that you do that, you'll become more and more focused, more and more relaxed, and feel more and more comfortable. And as you feel more and more comfortable, as you continue to pay attention to your breathing, intending to keep your mind focused on your breathing, mindful of when your mind wanders, reminding you to bring your attention back to your breathing every time you notice your mind is wandering, you'll find that you begin to experience a feeling of calm, comfort, and peace. And if you find that you don't have that feeling, notice what you've been doing or experiencing as you go through this exercise, And I'm sure you'll find that you have been resisting just simply allowing your mind to pay attention to your breathing, that perhaps you've been overly harsh or critical of yourself. And what you've perhaps been doing is telling yourself that you can't do this, that your mind is too active, that you're too distracted, that you can't relax, that this is not going to work. That's all fine. The whole point here is to be non-judgmental with the judgments that you catch yourself making, to be non-judgmental with the judgments that you catch yourself making, and even being non-judgmental with your inability to be non-judgmental. It's all fine. And then just allow yourself to watch what's going on inside your mind, inside your body. And then we just decide, okay, well, we've done this for enough time for now, and you've learned some important things from this experience. And so in a moment, I'm going to count from 1 to 5 to guide you to bring yourself back to a state of active alertness and normal waking consciousness. And as I count, just intend to come back up and to re-alert, so that wherever your mind went as you went inside with your eyes closed, whether it was wandering willy-nilly or focusing very, very deeply on your breathing or on some other comforting feelings inside, you begin to re-alert and reorient to your waking state, expecting to feel better when you open your eyes, expecting to feel calmer, expecting to feel more self-accepting, and looking forward to reflecting on what you've learned from the experience. So 1, preparing to bring yourself up. 2, now noticing your breathing, but just allowing yourself to breathe more normally as you do during your waking state, becoming aware of the way your body feels in the chair that you're sitting in or whatever position you're in. 3, re-alerting, preparing to open your eyes. 4, open your eyes. And 5, telling yourself that you are wide awake, that you're feeling great, that you're feeling sound in mind, sound in body, and in control of your feelings. Okay, so everybody should be back here, and this is just one tidbit of an exercise that is part of many exercises that I'm going to go through in the webinar on using hypnosis for taming depression. And as you can see, it's both experiential, and there'll be handouts so that you'll have access to the wording, the principles, the scripts, so you'll be able to not only apply these methods and exercises for your own betterment, but in your clinical work in helping depressed people. Thank you for listening. Again, please go to the IMDHA website to register for this webinar, which is coming up in about 2.5 weeks. Their website is www.imdha.com. My website is www.bruceeimer.com. That's BRUCEEIMER.com. Okay, well, thank you for listening. Hope you will join us for the webinar. Hope you will take advantage of this fantastic virtual conference of the International Medical and Dental Hypnotherapy Association. And stay safe, be smart, and stay well. Thank you. See you later.